Good morning and welcome everyone to the Daily Covfefe on Unsafe Space. I'm your host, Carter Laren, and I'm joined as always by the bad mama jamma in a hat from Texas, Keri Smith.
Good morning, Carter.
Morning.
I'm actually not from Texas. I'm from South Carolina.
Well, you're calling in from Texas.
Oh, I see. Yeah.
Hi, guys. You don't have to be from South Carolina your whole life.
That's true.
Switch. Now you're from Texas.
How are you?
I'm fine. I forgot to tell people to click the subscribe button. Please do that thing while Keri is petting her dog. The guy we talked about yesterday, the Trolton Brewing founder.
Oh, yeah.
Owner, Mike Marcus. While I was editing the show before we put it up, he blocked his Twitter. Like he's private Twitter account now. He blocked all of the followers and privatized. That's the word. He privatized his Twitter account.
I'm sure he feels like a victim.
Yes, I'm sure he does. And the other thing I wanted to tell you, what was it? Oh, so my wife is part of the Chinese community here in the Bay Area.
Mm-hmm.
She's Chinese. And she says to me yesterday, oh, because she doesn't always watch our show. I know it's a shock. She says, did you hear about the SAT adversity score thing? And I said, yes, we actually talked about it. And she said, I love this because it's so Chinese and it's so focused on success and achievement.
Yeah.
Yeah, the whole Chinese community, she says, yeah, the whole Chinese community has already thought about a bunch of different workarounds about how, like, okay, you like make a bunch of money and save up and then move to a poor area right before this time and blah, blah, blah. Like they're already like strategizing about how to game the system. So their kids,
That's awesome.
It's so funny to me. This is when, I don't know, people try to, social engineering generally fails when people try it. And this because people are resourceful and creative and come up with ways to get around your
absolutely
racist bullshit. So, Keri, we are trying to now limit this show to maybe focus on one major topic a day because it's getting out of control. Yesterday was fun.
Let's get focused.
Yeah, it was meandering. It was crazy. So I have one topic I want to talk about today. And I think it's a good opportunity to go to expose how I think the left, but also like the extreme right will do this too, but I see it often on the left. It's a good opportunity to expose what I call just it's pseudoscience. I don't know if that's the right word, but it's using science, using the veneer of science to push their agenda. And I'm going to this came up today because of everyone's favorite politician, Kamala Harris. So Kamala tweeted, I guess she tweeted this yesterday, but I missed it. She tweeted, when Black women walk into a clinic or doctor's office or a hospital, they are not taken as seriously as other women simply because they are Black. This due to racial bias, I think she means this is due to racial bias, and my Maternal Care Act will address this problem. So I want to, so actually you can see that I asked for a citation in just a few minutes ago. I asked for a citation. She did not obviously cite anything here. Now, the reason I want to bring this up is let's just be clear about what she's saying. She is saying that that doctors and hospital staff are racist against Black women. There's no other way to parse this, right?
To take that, yeah.
When Black women walk into a clinic or a hospital or doctor's office, they are not taken seriously. That's a judgment against how people treat them based on their race. Because she says simply because they're Black. So they're not taken seriously. So she is calling the clinicians, people in doctors' offices, doctors, nurses, people in hospitals, she's calling them racist. Okay? And of course, she's using that to then push her agenda politically. Now, you can look at this and say this is just an arbitrary claim, but a lot of people are going to assume that this is backed up by something. And I actually scrolled through, I was looking, I was like, there must be some study, there must be some citation, because you can get away with just saying this, but if you're running for president, someone's going to ask for some kind of quote evidence, right? And because it usually comes from something. And here's what it comes. Well, this is from what I can tell from the people who support her, who tweeted back, "Hey, you should this is the citation," right? So here's the citation. Now, granted, it's a Bustle article, but the Bustle article does talk about a study. But this is what people are citing. And this Bustle article is actually the thing I want to walk through, because it's a great example of exactly how this art of dishonest use of science is accomplished. So the title of this article is "Race and Maternal Mortality Are Linked, and Black Mothers Are Paying the Price." Now, that title, based on the study they're about to talk about, may be technically true. Race and mortality are linked in a study. That's not racism, okay? Which we'll get to in a minute. And Black mothers are suffering. Paying the price implies that, like, someone's charging them, so that's a little bit more of an active voice than you would expect. Like, they're getting the short end of the stick, maybe, or whatever. Statistics are not working out in their favor. So let's look at how they present this.
Can I interrupt for a second? It could be racism. I mean, the point is, right, we don't know what the cause is yet. Now we're about to get into the study, right?
Right. Now, to make a cause of racism, you've got to, I think, in order to accuse people of racism, you need evidence of racism. You can't just cite statistical differences between groups and say that must be racism. But we'll get to that in a minute. So, but you're right. It could be racism. And of course, that's the implication, and you'll see where we're going to go in this article. So here we go. So they start out talking. So most people actually don't read the whole article, or they skim, or they read quickly, or whatever. So they actually start out talking about a study. And this article is actually a couple of years old. They say, okay, the United States has one of, if not the worst, maternal mortality rate in the developed world. And they talk about that. And they talk about a CDC study. According to the Center for Disease and Prevention, 700 women die each year. Okay, blah, blah, blah. Now they say, but buried in the state and national data related to maternal mortality rates is an even more worrisome trend. Black women bear the greater risk of maternal health. Okay, so we're getting somewhere. So then they quote something. This issue is serious, according to someone uninvolved in the study, but involved, a director of the AFIA Center, a North Texas-based reproductive justice organization. So not a scientist, not a doctor, not
an activist.
Right, an activist. So according to this activist...
Reproductive justice. So this is my first time reading this to you. I might interrupt you just once in a while.
Yeah, go ahead.
But if you see North Texas-based reproductive justice organization, I mean, that's just saying this is what an activist said.
Yes, exactly. So, okay, so she says, this activist, Marsha Jones, the issue is quite serious. No women should be dying, however they are, blah, blah, blah. Black women are carrying a disproportionate burden of this. Everyone obviously agrees no women should be dying, and Black women, I guess, shouldn't have a disproportionate burden. But let's look at this. So they talk about the CDC definition of pregnancy-related death. I'm not going to get into it, but it's complications arising from pregnancy, before and after, blah, blah, blah. Okay, fine. And they show some charts, and they have some numbers just to show that the U.S. maternal death rates are increasing compared to other countries. Okay, that's fine. That's not a race issue here. Okay. And it says here's a study that found they could have been prevented, blah, blah, blah. Okay, so that's an issue. That's not the issue Kamala Harris is talking about. So, but that could be a separate issue we could talk about. But now they say, but just as worrying as the rise in the national rate are the racial discrepancies. So now they get into, according to the CDC, white women accounted for 12.7 deaths per 100,000 live births from 2011 to 2013. During that same period, African-American women accounted for 43.5 deaths per 100,000 live births. So there is a discrepancy, especially because we know that African-American women make up a smaller percentage of the population. So they are disproportionately represented. And they say here, Black women die from pregnancy-related issues nearly 4 times more often than white women. Now, let's pause here for just a moment. The scientific reaction to this, Keri, do you want to tell me what the scientific reaction to that statement is or should be? I mean,
my reaction would be, let's find out why.
Yes, thank you. That's the reaction. Why? That's a good question. Now, Kamala Harris, she may not stop at this point, but she stops trying to figure out why. She never doesn't ask why. At this point, the people who wrote this article and people who have an agenda like Kamala Harris, this is the point at which they have found something that could be interpreted as racism, and they're going to stop asking questions. They're going to interpret it as racism, and they're going to switch from talking about scientific stuff to assuming that it's racism. We'll look at it here. So
I actually, really quick, the other thing that's weird about this is that they often assume, like without asking why, let's figure this out, they often assume, like you're saying, well, it's got to be sexist or it's got to be that it's racist. It's always got to be some bias issue without looking into it. But they also assume that there's only one answer for anything, ever. Only one variable or factor.
Yes, well, that's really interesting because I know you haven't read this article, but we'll see in a moment how wrong that is. But yeah, they absolutely do that. And the reason for that is they want it to be the one factor that supports their agenda. So, all right, so we have this thing. There is a discrepancy. Obviously, that's bad. So we say, okay, well, this is weird. Why are Black women dying at a higher rate? Now, they go in, they give a little more detail on this. It's not just at a national level, it's state level. They talk about Texas. They talk about American College of Obstetricians and Gynecologists found that the mortality rate doubled, blah, blah, blah. So they're supporting this discrepancy with more numbers. That's fine. But now what they do, so far they haven't talked about racism being an issue at all, but they have said, hey, the reported mortality rate for Texas doubled within a 2-year period. So Texas has a particular problem with mortality. This is not about race yet, right? And the Texas Maternal Mortality and Morbidity Task Force and the Texas Department of State Health Services found that Black women bore the greatest risk. Right, again, matching the national data, Black women were dying disproportionately. Now they just include this tweet. This tweet is just a statement unsupported by science. This tweet is, we live in a country where the color of your skin can determine whether pregnancy and delivery is a death sentence for you. Okay, that's an activist tweeting. This person may be a doctor. I can't tell. They're wearing it looks like they're a doc because their doc is in their Twitter handle and they are wearing a white lab coat. But that doesn't make them not an activist. And they're not involved in this study. So they're just saying we live in a country that does this. So they're setting up a narrative here. They've said, hey, it's disproportionately, it's Black women. Now they've got this tweet randomly included. We live in a country where being Black is a death sentence, right? And then they give some more numbers. Now, what they do, so far, all they've talked about is, up until this point right here, they've talked only about the numbers and the discrepancy, and they've included this one tweet that alludes to some kind of racism. And now the next headline in the section is how racism affects maternal deaths. And this is almost a schizophrenic switch into complete anecdotes and activists commenting on racism. That's it. There's nothing else.
There is a segue though, Carter. I'm looking at this right now. Can I talk about the segue? The segue right before they talk about how racism affects maternal deaths is a paragraph where they give statistics. And here's what's interesting. It says Black women we're talking about Texas specifically. Black women accounted for 11.4% of births, but 28.8% of all maternal deaths. That's a really big statistical difference, right? 11% of births, but 28% of deaths.
Right.
And then they say, in contrast, Hispanic women account for 48% of births, and then a lower percent of maternal deaths, they account for 30% of maternal deaths.
Right.
And then they say white women account for 34.8% of births and 37% of deaths. So more white women are dying than they are giving birth, right? Is that what there's a higher percentage?
They're
Not more
probably,
white women, but the percentage is higher.
yeah, they're close though. They're a lot closer than the black women percentage. But this is not.
So but my point is, if statistics, if these numbers, if the number is all they're looking at, then the very numbers they just gave for Hispanic women and white women disproved the racism cause, because Hispanic women, are we operating in a system where there's Hispanic privilege and nobody's racist against Hispanic women? Am I making this point clearly? Or like,
Yeah, I wouldn't call this a segue though. This is just them saying there's disparity in the data. This isn't a segue to talk about, they're not blaming anything. This is still just a presentation of the data. And as you're pointing out, the data
doesn't support the next sentence.
Well, but their sentence is, no, but their argument here is so this is the other thing they do. And it's a good point you're bringing up. They just ignore the data that they don't want to talk about. They're not talking about Hispanic women in this article. They're talking only about black women. So they're not saying there's a white advantage, there's an Hispanic disadvantage or an advantage. They just are looking at, this whole thing is only about black women being disproportionately at risk. And they are here, according to the statistics. It's all about black women being disproportionately at risk. So the number they want you to focus on is 11.4% of births in Texas. They made up 28% of all maternal deaths, right? Now,
but if the answer were racism, they give you the stats for Hispanic and white women as well. And those don't play out.
Racism only against black women, right?
Okay.
Right? That's, so they're, but I wouldn't call this a segue. This is still just citing, this is true, right? This paragraph is just truth. That is true. All these stats, I assume that they came from the report, unless they're made up. This is just citing statistics, right? They haven't said anything about why. They've said black women have this proportion, Hispanic women have this proportion, which, as you point out, kind of would contravene a racism as an explanation. But they haven't tried to explain yet. The only thing they've done to explain so far is dropped this little tweet here that says, I'm not showing the screen. The only thing they've done so far is drop this little tweet here that says, we live in a country where the color of your skin can determine whether pregnancy and delivery is a death sentence. But now they've got a new head. So now they have a subheading here, or a heading in the article, how racism affects maternal deaths. So now I want to point this out. They've not made any scientific case for racism whatsoever at all. All they've said is there's a discrepancy. They've done nothing to try and explain the discrepancy. And now they're using the word racism. And now we're going to switch. We're going to switch to anecdotes. When I was pregnant, blah, 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 says this rep, I'd always say I didn't want to be a statistic. I mean, okay, fine. It's anecdote. I'm going to ignore it because it's an anecdote, which is irrelevant. And she, of course, this anecdote is this woman, this representative who thinks that it's racism, right? The experience has given theory a unique perspective in tackling the racial discrepancies. Okay, so now here we go. They start to ask the question Keri wants to ask. But why is there such a big racial disparity in the first place? That question should have occurred before this heading about how racism affects maternal death, but it didn't. So here we are. Why? Why are black women more likely to die from pregnancy-related causes? And then they have to pretend to be scientific, so they have a nod to science. And here's the nod to science. Like many health-related issues, the answer isn't simple, and there's no one single contributing factor at fault. So this is their disclaimer. This is like, Keri, this is like when there's the fine print in some, may cause death and, vomiting and blah, blah, blah. It's like, this is the fine print, like on a drug label. like many health-related issues, this article is actually bullshit, right? The answer isn't simple, and there's not one contributing factor. But now we're going to talk about the one contributing factor being race. This is their thing. So now they say, okay, according to research from the CDC and the Texas Maternal Mortality and Morbidity Task Force, the most common causes, plural, of maternal death in all women are cardiac events, drug overdose, hypertension, eclampsia, and hemorrhaging. Here's the real answer. Spokesman for the Texas Department of State Health Services, Chris Van Dusen, says, we know that African Americans have higher rates of those chronic diseases and so suffer the complications of them at a higher rate. Oh, Keri, I know that you're enjoying your dog time right now, but does that answer the question of why there might be a discrepancy from a more scientific viewpoint?
Yes, I would just say two things. Their answer for this is the reason why African Americans, this is what an SJW would say, the reason why African Americans have higher rates of these chronic diseases is because of systemic racism. So their why always points to racism. But I know I'm belaboring this, but the very stats they gave right before this it completely disproves what they're saying, because the ratio for Hispanic women goes the other direction.
Right. No, it's a great point.
And so it doesn't make any sense. Why would they include a stat that refutes what they're saying?
Right. So I get that they would argue that these diseases are, because of systemic racism, these diseases occur at higher rates in African-American communities. But that's the case they would have to make then, right? They can't just jump to racism here. They would have to have a separate study demonstrating that.
Exactly. They would have to have a separate study saying
cardiac events, drug overdoses, hypertension, eclampsia, and hemorrhaging are due to the white, systemic white patriarchy, whatever, right?
And here's the study proving that.
Right. But they don't. So now they've said, okay, so we've cited this guy, the one guy who's appears to have at least a medical position. I don't know if he's a doctor, but he's in charge of this Texas Maternal Mortality and Morbidity Task Force. This one guy says, well, African Americans have higher risk of these complications, which are the cause. Okay. Now this is interesting. So they quote the guy who talks about the truth. And then they just go right into, so now I think basically the rest of the article, I'm not sure, but I think it's the entire rest of the article is quotes by people who are just activists. But let's look. So now we switch. So the next paragraph has a quote by Elizabeth Dawes Gay, who is from she's the steering committee chair for the Maternal Health Rights and Justice Group, Black Mamas Matter Alliance. So this is an activist. This is an activist. And the next paragraph, she's going to, so it starts with, but one alarming factor potentially impacting the rate is racism. So this is just a throwaway sentence, right? They've said nothing to support that one alarming factor might be race so far, or like racism. They haven't said anything to support that yet at all. Nothing. So now here's their supporting evidence. So they've talked to some doctors. They've got some stats from the CDC. Now they say, but there might be it could be caused by green men from Mars. One alarming factor potentially impacting this is racism. Okay. I guess the factor would be alarming if it were racism, and I guess anything's potential. So they put this phrase in here. And then what did they do to support it? They cite this woman who is an activist. And the supporting evidence is this activist saying, I think racial discrimination plays a significant role. Okay. So someone whose job it is to think that racial discrimination plays a role in everything thinks that it plays a role in this. Okay. So as an example, so then she's also schooled at citing data that doesn't support her case. She points to California. And I won't get into what she says about California, but basically she says, look, California also has a discrepancy between black and white women. Okay, but we're talking about why the discrepancy is there. There's no data about why the discrepancy is there. So then their next heading, how the healthcare system fails Black mothers. Okay, so now we're making it look like it's not just racism, but it's systemic racism. It's institutionalized racism. There's a system designed to fail Black mothers, but as Keri points out, to do wonders for Hispanic mothers who do better than whites. Jones agrees that the disparities seen in maternal mortality rates are centered in racial discrimination. Of course, Jones agrees. So Jones, let's remember who Jones was. Jones is Marsha Jones from the AFIA Center, a reproductive justice organization. So, okay, so the first activist says, I think it's racism. Here's some data that has nothing to do with showing it's racism. Then, now we're saying it's systemic racism. This activist agrees that it's systemic racism. Jones agrees, right? Jones agrees. The disparities are centered in racial discrimination and says how Black women are treated with the healthcare system likely impacts numbers. What we are seeing is a result of a system that continues to fail Black women. It's a direct result of how Black women are received when they enter the healthcare system. So, and this is actually the circular argument that I think Keri will love the most. Keri, you can correct me if I'm wrong, but this is my favorite part of this. If we see discrimination in every other industry, how can we say it doesn't exist in the healthcare industry? Representative theory says. We see it in the banking industry, in the criminal justice system. Now, unfortunately, we're seeing it in maternal care. So they are basically just saying, we've done similar things in every other area where we cherry pick some data or just look at some data and interpret it as racism because that's who we are. And now that we've interpreted that as racism, we've got a bunch of weak interpretations of racism all around, and we're going to use each other weak interpretation to prop up the weak interpretation that we have of this one. So, hey, there's some logical fallacies in our assuming that it's racism here, but look, we committed those fallacies in all these other areas. We can't have committed fallacies everywhere, can we? There must be racism. It's a completely circular argument, and I'm not going to read the rest of this article. It ends actually here pretty quickly. But you know, the point here is, this is what they do. They look for something that, as Keri points out, they look for the statistic that supports the argument they want to make in some very vague, actually very weak way, right? There's a disparity between Black and white women. They ignore the parts that they don't like. So they ignore that Hispanic women, actually, if you are a pregnant woman, the best thing to be is Hispanic, apparently, according to the studies, because you have the lowest mortality rate compared to the percentage of the population. So Hispanic women are treated the best in hospitals, according to this. So if it's all about how people are treated, right, which it's probably not, which is the point. So they take this stuff, they take this data, they take the parts that could be used theoretically to support their argument. If there was supporting evidence underlying it, they don't bother to look for the supporting evidence. They jump to the conclusion they want to, and then they cite a bunch of other conclusions they've jumped to in other areas and try and put it together as this package deal that, like, look, there's systemic racism because we assumed there was systemic racism everywhere else. And this one fact, taken out of context, could be evidence of systemic racism if we don't bother to look at any of the why, if we ignore the fact that there's other contributing factors, if we ignore the fact that Hispanic women do better, blah, 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 blah. And it's a great parallel to the education discussion we were having the other day about Asians, right? Asians have to be ignored in income and education studies because they contravene the white supremacist narrative. So we just ignore that Asians do better, right? Well, in this case, we just ignore that Hispanic women do better. And we jump to these conclusions, and the left is all about ideology and jumping to conclusions, and they masquerade things in science, and they have this leftover idea that science is the purview of the left, right? And this goes way back to the communism, right? Communism viewed itself as the scientifically derived political system, which it's not. It's anti-science, but that's a separate issue. And this was an easier argument to make when back in the 80s, when there were people on the religious right arguing against evolution and that kind of thing. But they think that science is something that is just a tool to use to justify their ideology, not something that needs to be actually explored. And you look at the underlying factors. You stop as soon as you find one piece of information that could potentially be used to support your narrative. You stop, you highlight that piece of information. You don't do the research. You don't do the work to show that your narrative is correct. You just assume your narrative and move on and go your jolly way and try and get elected. So that's the issue I want to talk about today. Kamala Harris and pseudoscience coming from the left.
Yeah, my favorite is like you said, the circular argument of, I mean, they tell you who they are there. They're like, if we see racism everywhere, how can we not see racism everywhere?
Yeah. Yeah, I thought you might like that part, Keri.
I did like that part. Yeah.
I know this was mostly me ranting and you petting your dog, although it looked like you were having fun.
I was having fun.
Sorry, is there anything else that I missed in here or any overall social justice comments you want to make?
Just one thing I wanted to point out. One of the quotes that was highlighted from one of the activists, and she says something about Black women's bodies. That's something you'll see SJWs do a lot. They talk a lot about Black and brown bodies. They use the word bodies a lot, and it's really strange that they do that because they're kind of dehumanizing people.
Why do they do that, Keri? Here's the quote right here. Yeah. The healthcare system that has riddled with bias about Black women's bodies. This is the Jones activist. Why do they do that?
I'm not exactly sure. I think they would say that they're pointing out that people who are racist only see them as body. I don't know. But the point is, no, you're the only people using that language. It's weird. It's like saying something's a dog whistle, but you're the only person who hears it. The people that you say hear it don't hear it. It's like, maybe you're the racist. Like, it's kind of weird.
Racists are very preoccupied with bodies, right? Racists are just naturally, they want to see what color is your skin? What does your body look like? That's very important to racists. And most people who aren't racists view their bodies as actually one of the least essential parts of a person, right? Like, you're not essentially your body, you're your mind, and religious people would use the word soul, right? That's who you are. Who you are, Martin Luther King would say, the content of your character. That's who you are, right? But racists see you as a body, not a person.
But they also specifically only do this to Black and brown bodies. I've never seen SJWs talk about white bodies.
Oh.
It's weird.
Well, yeah, maybe the implication is that maybe that's how, I don't know, maybe they think that makes it look like the white system is treating them as bodies instead of humans. Is that what you're saying?
Yeah, like they're trying to put that across, but it's like, no, you're the ones referring to human beings as bodies based on what race they are. Like, yeah. I don't know, it's weird.
That is totally weird. I don't know. Anyway, this was a show about one topic, so we should stop now.
Yes.
Follow us. Please press the subscribe button, and we will see you tomorrow. Do we know who we have? Can we say who we have on the show on Deprograms tomorrow?
I don't think so. Not yet.
Okay. But we'll see you tomorrow regardless. And yeah, I don't know. Keri, say something brilliant.
Have a nice day, guys.